Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could return for another segment. In this segment, we're going to be speaking with Sheetal Parmar. She's joining us here as a board-certified genetic counselor and vice president of medical affairs at Natera. She's joining us to discuss non-invasive prenatal testing, or NIPT, that the American College of Obstetricians and Gynecologists now recommend. Welcome to Health Professional Radio. Sheetal Parmar, thank you for joining us.
Thank you so much for having me.
Well, I did, of course, mention your board certification as a genetic counselor. Give us a little bit of insight into your background. What does a genetic counselor do?
Yeah, so genetic counselors are healthcare providers that can help you understand how your medical and family history will impact yourself as well as your pregnancy in this case, and can discuss the different testing and screening options that might be available to you based on your family history and your medical history.
Now, was genetics your first love when you went into medicine?
It is. I have known that I wanted a career in genetics since I was in high school. And genetic counseling is an amazing career because it allows me to be a genetics nerd, but also allows me to help people.
Non-invasive prenatal testing, NIPT. I've never known of any prenatal testing that was non-invasive other than an ultrasound.
Yeah, so that's a really great point. People don't realize that there have been screening tests in pregnancy that have been available for probably 40 years, but non-invasive prenatal testing, or NIPT, is newer. It's been around since the late 2011, 2012, and it can help to identify if a pregnancy is at risk for certain genetic conditions. We call them chromosome abnormalities. Examples include Down syndrome or trisomy 13 or 18. And it's a blood test. So it's non-invasive in that it's a simple blood draw during the pregnancy from the mom, and it can be done as early as 9 weeks of pregnancy, and it's ordered by a physician.
Who's recommended to get this type of testing?
Anyone. So anyone who is interested in finding out more information about the pregnancy, specifically as it relates to chromosome conditions, can have this screening. All women, most pregnancies are normal and healthy and have no issues, but all women have some risk to have a pregnancy with a chromosome condition. So this test is a really great option to screen the pregnancy to identify if more testing needs to be done, and anyone can have it.
Now, is this also a diagnostic test or simply screening? And if it's both, great. If it's not, what's the difference?
Yeah, that's a really important distinction to make. NIPT is a screening test. It is not designed to diagnose a condition, but what it can do is determine whether you are at increased risk or decreased risk for certain conditions. So if you're at decreased risk, it's a reassurance that most likely everything is fine and the pregnancy is not affected with these conditions. If you're at high risk, then you go on to do actually a diagnostic test. A diagnostic test is definitive. It tells you for sure if the baby has one of these conditions. And a diagnostic test is usually more invasive. So during the pregnancy, an example of a diagnostic test that some people have heard of is an amniocentesis. That's a test where they take a little bit of fluid from around the baby. And that is more definitive, but there may be some risks to the pregnancy associated with it. So for a lot of women, they want to do the screening test first to figure out what the next steps are. And if they are at high risk, then that diagnostic test is what's recommended next.
Are these results, can we get the results at the testing site, at any hospital, any lab, or are there specific special type of lab that's employed to get these test results?
Yeah, so, certain genetic testing laboratories or laboratories that offer genetic testing will have it. It's not necessarily available through every single lab. So, for example, I work for Natera. It's a genetic testing company. It is a blood test that's ordered by your healthcare provider, and they can, send you a blood draw slip, or you can do the blood draw in your office. It takes about, 5 days to get results, but it is ordered through your healthcare provider.
Now, is the fact that it's a blood test, is that the main reason that it's able to be used so early in a pregnancy?
Yes. So it is because it's a blood test. What we're looking for are, fragments of DNA that are circulating in mom's bloodstream, in the pregnant patient's bloodstream during the pregnancy. And we can look for those as early as 9 weeks with Natera's test, which is Panorama. For some other places, it can be as early as 10 weeks. But yeah, you can do it early in pregnancy to get information within the first trimester.
Now, you say that this has been around since the early 2000s, 2011. Is this test automatically offered as an option to any woman who comes in and says, hey, I'm pregnant, where do we go from here? Or is this something where certain questions need to be asked? Because I was not aware of it. And if our listeners aren't aware of it, what questions should we be asking to receive this type of a test?
Yeah. So, some type of screening or testing is recommended for all pregnant patients, but it is important to discuss your options with your healthcare provider. So I'm going to say there's, 4 questions you want to ask your healthcare provider. The first is, how your medical and family history might affect the pregnancy. For example, what are the maternal age risks? What are your family history risks that might impact what test you want to consider? The second is to have that discussion between what is the difference between a screening test and a diagnostic test. And then if you choose to have a screening test like NIPT, discuss what the accuracy of that is. So for example, what does it mean if I get a low risk result? What does it mean if I get a high risk result? And of course, you want to discuss what the different risks are with the different tests that are available to you.
Where can listeners go and get some more information about this test and other options available?
We encourage everyone to discuss this with their healthcare provider, but to get more information, you can also get at Natera's website. You can find out more information about the Panorama test as well as genetic counseling services, and that's at www.natera.com, which is NATERA.com.
Well, I appreciate you joining us here on Health Professional Radio. It's been a pleasure speaking with you. Hopefully we'll speak again. Thank you.
Yeah, thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Sheetal Parmar. She's joined here as a board-certified genetic counselor and vice president of medical affairs at Natera. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download a SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.